The highlight of the week, sponsored by Dave Franek Auto. Looking for that first car for your son or daughter? Don't panic. See Dave Franek.
During my residency, my chairman, Dr. Ben Rush, did weight loss surgery. I found these surgeries particularly difficult, particularly challenging, and physically challenging as well. But the outcomes and the way that we changed people's lives was so dramatic, it had such an impact on me that I felt I wanted to be part of this change as well.
When you do a surgery on a patient and lose all the weight, tell us the feeling that you get as a surgeon, as their doctor, as the person that consoles them and takes them through this every step of the way.
Imagine your child when they take their first step and the joy that comes over you in seeing that. And knowing that you are an integral part of that, knowing that they are getting ready to experience life as you and I would typically experience life.
All right, tell us a little bit about how surgery works. For a person out there maybe watching this interview, does insurance cover it? I guess that would be a big question for people. And how do they go about it if they've seen this interview and they're interested in getting the surgery done?
Okay, that's a three-step question, and I'd like to answer first about what the surgery does. What the surgery has is one or two components. One component being restrictive, where we take the stomach and actually either restrict the amount that goes into it by putting a device around the top of it, i.e. a band, or we cut and partition the stomach into a smaller size, such as in a gastric bypass or gastric sleeve. The other portion of the operation is a malabsorptive portion, such that by restricting the amount that goes into the stomach, into the system, we now move it through the system a lot quicker, and therefore it's not absorbed as well. Based on the type of operation, we'll give you a percentage of weight loss. Best case scenario with a gastric bypass is at about 90% of your excess weight. So if you have 100 pounds overweight, you can expect to lose 90 pounds within a year to a year and a half time. The second part of that question was, does insurance cover this? Most insurance companies will cover this, but there is a process that one must go through. The process can take up to 3 to 6 months in order to have this done. The third part of the question, how do you go about making the decision and getting to a bariatric surgeon? It's simply, once you have made the decision that you're sick and tired of being sick and tired, that you have done multiple diets, exercise, and crazy regimens to lose weight and have been unsuccessful, then simply look at the St. Clair's Programs for Life website. There you'll be put in touch with a new patient seminar, which is our introductory seminar to describe bariatric surgery and our services. Then you will be assigned to a surgeon, or you may choose a surgeon of your liking, and you will further have that discussion to further this process.
I do, by design, operations using small holes to do big operations. And in 1999, it was a radical consideration to do gastric bypass surgery or obesity surgery laparoscopically. I happened to be good at doing laparoscopic surgery. I was taking out gallbladders and spleens, and I was doing other surgeries called Nissen fundoplications. I did all kinds of different operations, and gastric bypass was thought to be very, very difficult laparoscopically. Well, I began to pay attention to what exactly was being done, thought that I could do it, and with my partner at the time began to do gastric bypass. And we found that there was an enormous number of people out there who were interested in the procedure but wouldn't go forward because it was dangerous with a big incision, that they were stuck in the hospital for long periods of time and sometimes the intensive care unit for long periods of time. What we found when we did these operations laparoscopically, people recovered very, very quickly. They got on their feet and they got back to doing meaningful things in their lives. And the results of having done that, changing lives, was really very, very important to continuing ourselves going onwards. We had seen a lot of cancer patients, we had seen a lot of patients who had chronic disease, and with each subsequent visit, when you saw those patients, they got worse. This was exactly the opposite. When we saw our patients after surgery, they got better, and they got better and better and better. And they were often very, very happy visits. And that makes for happy patients and happy surgeons. It's nice to do operations where you can really positively affect somebody's life.
Yeah, you talk about the surgery, in America, obesity is a big problem. We talk about it on how it, shortens your life, it gives you knee problems, back problems, heart problems, cause all kind of diabetes. Talk about some of your line of work, the feeling of getting to change somebody's life and make them live healthy.
It's what everybody goes to medical school for. Ultimately, we all went to medical school to help people. And you help people in different ways. As a surgeon, you do operations to take people who are not feeling well and make them healthier and better. And there is no better way that I've found in all of my time medically to be able to change somebody's life on a positive way than what I do. Obesity surgery has been tremendously effective in doing that. And I've seen more effect on more diseases based on the operations that I do than I ever thought that I would. It's very rewarding to be involved in changing what is a reclusive lifestyle, or a lifestyle where people are restricted, to a lifestyle where their opportunities open up in front of them. I've seen people get promotions at work. I've seen people get out from under chronic diseases that they were told they would never be able to really engage in normal life with. I've seen tremendous turnarounds in people's lives, and I see it every day. And it's young people as well as old people. It's not age limited either.